of discussion is thyroid gland. Problem based question may come from thyroid. What type of symptoms, with what type of symptoms a patient may come to you? The patient may come to you with a swelling in front of the neck. That is called, you will say goiter only when you will be confirmed that this swelling is developed from thyroid. Then you may call it goiter. Goiter means any enlargement of the thyroid gland. What is goiter? Any enlargement of the thyroid gland is called goiter. The goiter may be physiological also, physiological goiter, and maybe pathological also. Physiological means at the time of puberty there may be some enlargement. At the time of pregnancy there may be enlargement. At the time of lactation there may be enlargement. So these are called physiological goiter. And pathological goiter is when there will be excessive secretion of the gland, that is hyperthyroidism, or sometimes it may be due to hypothyroidism also. So now how will you distinguish if a patient comes to you with a swelling just where the thyroid lies? By one test you can confirm. If you will ask the patient to swallow his saliva, then if it is thyroid gland, it will move up and down, right? So by this test you will be able to diagnose that this swelling is from thyroid. Now thyroid is very unique. In some respect it is very unique. Number one, it is the first endocrine gland to develop. It is the first endocrine gland to develop. Number two, it depends on external material, raw material for its secretion, I mean iodine. And it is the only gland which stores its secretion. It stores its secretion. When the hormone which it secretes, it is stored within it, and when there will be requirement, it will be secreted from this. Right? Now, and it is the only thyroid endocrine gland that lies superficially. অন্য কোনো thyroid gland superficially নেই. Right? Now, the dimension of this gland. What is the dimension? What is the surface? What is the weight? You should know it. Number one, it is about 25 gram. This gland is about 25 gram. It has three surfaces and two borders. Three surfaces, দুটো border থাকে, তিনটে surface তিনটে border থাকার কথা. In some book it is written three border, in some book it is written two borders. One border is blunt. One border is blunt, that's why it is said that it has two borders in three surfaces. Now, where it lies, there are two glands and they are connected by isthmus. They are connected by isthmus. That isthmus lies in front of trachea. Which tracheal ring? Second, third and fourth tracheal ring. So there are two thyroid glands. They are called lateral lobe, and it is situated in front of the trachea. There are 2 Tracheal rings, second, third and fourth. It is very important for your surface marking. Now it is pyramid in shape. It is pyramid in shape. So it has three surface. Three surface, it is pyramid in shape. Now I will draw it. It is pyramid in shape. It has an apex and base. Right? There are two thyroid glands side by side connected by isthmus. Now, what are the three surfaces? Number one surface is superficial surface. Superficial surface, or it is also called anterolateral surface. I am now showing the transverse section. This is tracheal ring, trachealis muscle. Here lies the esophagus. Now in front of it lies the thyroid gland. This is thyroid gland. So it lies in front of the trachea. Now this surface is called medial surface. This surface is called anterolateral surface. This is anterior and this is the posterior. And this surface is called posterior surface, or posterolateral surface you may call it. Posterior surface or posterolateral surface. According to the structure, what are you talking? I will ask question. Give attention to. According to structure, this surface is also named. This surface, that is medial surface, as it is lies to the tube. There are two tubes. One is trachea and esophagus. So this surface is also known as tubal surface. Near the posterior surface lies carotid sheath. And you know carotid sheath contains common carotid artery and internal jugular vein. And behind lies the vagus nerve. Medially lies common carotid artery, then lies internal jugular vein, and behind lies vagus nerve. Right? This is trachea, this is esophagus. This is carotid sheath. So this surface, posterior surface, is also known as vascular surface. Medial surface is known as tubal surface. Posterior surface, as it is towards the carotid sheath containing, so it is known as vascular surface, and this surface is known as muscular surface because strap muscles present in the anterolateral surface. What are the muscles? You have already done in dissection. Bolo. Bolo. What are the muscles that lies on the anterolateral aspect of this thyroid gland? Strap muscles. Bolo. Sternohyoid and tumoro. Sternothyroid, sternohyoid and anterior belly of omohyoid. anterior नहीं, superior inferior belly होता है. Superior belly of the omohyoid. Just deep. On the deeper aspect lies the sternothyroid, and superficial to that lies sternohyoid, and laterally lies superior belly of the omohyoid. This is the sternothyroid. This is sternohyoid. This is superior belly of omohyoid. And superficial of all, it is overlapped by another important muscle. What is that? Anterior border of sternocleidomastoid. Anterior border of sternocleidomastoid. Here lies the anterior border of sternocleidomastoid. Sternocleidomastoid. Right? That's why this surface is also called muscular surface. Right? Now, again I am recapitulating. The medial surface has got two tubes. One is larynx and trachea, one is pharynx and esophagus. Two nerves. One is recurrent laryngeal nerve that lies in the groove between the esophagus and trachea. So here lies the recurrent laryngeal nerve. Another nerve is present that is known as external laryngeal nerve. So there are two tubes and two nerves and two muscles. What are these two muscles? Number one, it is not shown in this picture, but these two muscles is, one is cricothyroid muscle, cricothyroid and inferior constrictor. Cricothyroid and inferior constrictor lies in relation to the medial surface, right? So these are the medial relation. And anterolateral relation I have already told you, and posterior relation is that. Now, most posterior lies, here lies, this is, what is this? This fascia is known as pre-tracheal. Trachea तो यह, trachea तो এটা, pre-tracheal में तो trachea এখানে হবে. Prevertebral. It is the prevertebral layer of the deep cervical fascia. इसका पीछे है vertebra, right? So these are the transverse section of the thyroid gland, right? Now, come to the covering of the thyroid gland. It is very important. Covering of the thyroid gland is important. Thyroid gland is covered by two sheath. Number one is false capsule, one is true capsule. What is called true capsule? From where it is coming? True capsule. अच्छा ये क्यों देख रहा है? ये तो बाद में देख सकता है. हम तो ये वही लाइन में तो हम तो पढ़ाएंगे नहीं आपको. तो ये देखने से तो तुम्हारा तो अटेंशन ये नहीं रहेगा. तो योर एम इज टू अंडरस्टैंड द बेसिक थिंग्स, देन यू विल स्टडी. अदरवाइज बोथ विल बी स्पॉइल्ड. यहाँ पे भी अटेंशन नहीं होगा, वहाँ पे अटेंशन नहीं होगा, कुछ नहीं होगा. अगर किताब से अगर हम पढ़ते तो आपका किताब लेकर हम पढ़ा देते और मालूम आपका और मीनिंग हम बोल देते तो हो जाता. There are two capsules. One is false, one is true. True capsule means which develop from the fibrous stroma. This gland contains fibrous tissue. So from this fibrous stroma, that capsule which is developing, that is called true capsule. And other, that is pretracheal or deep cervical fascia. I have already discussed it when I discussed the cervical fascia. There I had shown that the pretracheal layer splits to enclose this gland. This pretracheal layer forms the false capsule. Now one important question will be asked here. The venous plexus, you will give attention to venous plexus that lies within this gland. Whether it lies between the true and false capsule or it lies deep to the false capsule. In case of thyroid gland, venous plexus lies deep to the true capsule. But next question will be asked, in case of prostate, what happens between true and false capsule? So, at the time of removing the thyroid gland, the surgeon generally what he or she does, she removes with the internal capsule, true capsule. So there will be less bleeding. You must remember this. This question will be asked. Where lies the venous plexus? You will be within the substance of the thyroid gland, that is deep to the true capsule. But in case of prostate gland, it lies between the true and false capsule. You should remember it. Now, parathyroid gland, you know, along with the thyroid gland, parathyroid gland lies in relation to thyroid gland. It lies between the true and false capsule and at the posterior border. At the posterior border, it lies between the true and false capsule. Now I will draw it. This is the pretracheal layer. And this is the true capsule. And in between true and false capsule lies the parathyroid gland in relation to its posterior margin. Here lies the parathyroid glands. How many parathyroid glands are there in our body? 4. On each side 2, upper and lower. That's why when surgeon removes the thyroid, he keeps the posterior part of the thyroid intact. Because if it is removed, then parathyroid also will be removed. That's why it is kept here. Right? Now come to the arterial supply. I think you have already memorized the branches of the external carotid artery, right? Which external carotid artery supplies the gland?
Superior thyroid artery.
Superior thyroid, very good. From where it is coming? It is coming from the external carotid artery. External carotid is coming from where? बोलो क्यों बोलो कान ने सुना नहीं जा रहा है external carotid artery is coming from where? At which level common carotid artery divides into external and internal? At which level? Very important level. At the upper margin of the thyroid cartilage. At the upper margin of the thyroid cartilage, this common carotid artery divides into two, external and internal carotid. From the external carotid artery, the superior thyroid comes and supplies the apex and upper part of the thyroid gland. Now, another artery supplies, that is called inferior thyroid artery. Inferior thyroid artery branch of inferior thyroid artery branch of thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk. Thyrocervical trunk is the branch of thyrocervical trunk is branch of subclavian artery. First part of the subclavian artery. Subclavian artery. Next, you should be asked what are the other branches from the first part of the subclavian artery. Next question should be now thyrocervical trunk, thyro and cervical. So from here, inferior thyroid artery plus transverse cervical artery plus suprascapular artery. These three artery are the branches of the thyrocervical trunk. Now it is supplying the lower part or base of the thyroid gland. Another artery supplies sometimes, that is called thyroidea. Thyroidea. That thyroidea is coming from where? It is coming directly from arch of aorta, or also it may come from brachiocephalic trunk, right? So these are the three arteries that supplies the gland. Now vein. What are the veins? How many veins are there to drain the thyroid gland? Number one, here one important thing is that generally these veins of thyroid gland, they do not accompany their arteries. They do not accompany their arteries. Superior thyroid vein drains into internal jugular vein. Middle thyroid vein, it also drains into the internal jugular vein. And there is inferior thyroid vein. Here extra, middle thyroid vein is extra. Inferior thyroid vein is coming from the isthmus. A bunch of inferior thyroid veins come out and they will drain mostly into the left brachiocephalic vein. There is another vein that is called coccus vein, inferior thyroid vein or coccus vein, that drains into the internal jugular vein. Most of the veins drain into the internal jugular vein. Now, artery, nerve. What are the nerves that supply the thyroid gland? It is coming from the vagus nerve. Ultimately, vagus nerve is the main. From the vagus nerve, superior laryngeal, there is a nerve that is called superior laryngeal that divides into internal laryngeal and external laryngeal. That external laryngeal nerve supplies the thyroid gland. Internal laryngeal will supply inside the larynx, and this external laryngeal nerve will go and supply the cricothyroid muscle. Why it is important, I am coming later. And another important nerve that lies within the groove between the esophagus and trachea. Name of that nerve is, which lies in the groove between the trachea and esophagus? Recurrent laryngeal nerve. Recurrent laryngeal nerve. This recurrent laryngeal nerve also supplies the thyroid gland. Why these nerves are important? At the time of surgery, when surgeon will operate, if this recurrent laryngeal nerve is cut, what will happen? Recurrent laryngeal nerve supplies all muscles of the larynx except cricothyroid. So if all muscles of the larynx are gone, then what will happen? You will develop hoarseness of voice. Hoarseness of voice. Now, if external laryngeal nerve is cut, and you know external laryngeal nerve supplies the cricothyroid muscle. Cricothyroid muscle is the tensor of vocal cord. So vocal cord will be lax, and that will also produce hoarseness of voice. Now one question comes, if thyroid gland is enlarged, this enlargement occurs to which direction? Upward direction or downward direction or postward or forward? Down and posteriorwards and downwards. If this gland is enormously enlarged, what effect it will produce? You have to explain from your anatomical knowledge. That question comes like this. Explain by your anatomical knowledge if there is huge swelling of the thyroid gland. Now, on seeing this picture, you can explain all this. Number one, when it presses the recurrent laryngeal nerve, it will cause hoarseness of voice. When it will press the trachea, it will produce dyspnea, difficulty in breathing. When it will press esophagus, then what it will produce? Dysphagia. So these are the symptoms it may produce, right? Dysphagia, dyspnea, and also dysphonia. Dysphonia, the term is, if recurrent laryngeal nerve is see, the patient will develop hoarseness, that is called dysphonia. So dysphonia, dysphagia, dyspnea. So these are the symptoms when the gland will be enlarged, right? Now, why the gland will not be enlarged upwards? Because you know, peritracheal fascia is attached to the oblique line of the thyroid cartilage, and sternothyroid muscle. Sternothyroid muscle is attached to the oblique line of the thyroid cartilage, and just below that muscle lies the thyroid gland. So thyroid gland will not be able to move upwards because it will be prevented by the sternothyroid muscle, right? So these are the regarding muscles. Now let us discuss about the, sometimes from the isthmus of the thyroid, a pyramidal shaped gland may lie, that is called pyramidal lobe. This pyramidal lobe is attached to the, thyroid gland, from where thyroid develops. Right. Thyroglossal duct. From the foramen cecum of the tongue, there is a downward growth of a, কি বলে তোর epithelium from the downward growth from the foramen cecum, that is called thyroglossal duct or median thyroid diverticulum, that will pass in front of the thyroid cartilage, and there again it takes upward turns and again come back, and then it will come it will descend in front of the thyroid. There it will be expanded and form the thyroid gland. Some part may remain intact. Some part may remain intact. If it remains intact from the hyoid to thyroid, that is called fibrous stoma. What is the name? Levator means elevate. Levator thyroidi. Levator glanduli thyroidi. Sometimes you may be asked questions, though it is now asked at the time of clamping the superior thyroid artery. Surgeon will clamp nearer to the gland or away from the gland. In case of superior thyroid artery, in case of inferior thyroid artery, surgeon clamp the inferior thyroid artery near the gland or away from the gland. দুটো আলাদা আলাদা হয়। In case of inferior thyroid artery actually lies in close relation with the recurrent glandular nerve near the gland. That's why it is tied or clamped away from the gland. But in case of superior thyroid artery, it is nearer to the gland, because when it will be nearer to the gland, these two structure, this is external laryngeal nerve and superior thyroid artery, they will be separated. So there then it is clamped. Right? এখন করা হয় না, এখন আরো অন্যরকম করা হয়, থাক সেটা বলবো না। So these are the some practical questions that are frequently asked in the exam. এইটুকু কনসেপ্ট যদি ক্লিয়ার হয়ে থাকে, এনি কোশ্চেন ফ্রম থাইরয়েড ইউ ক্যান রাইট। এবং হিস্টোলজিতে পড়বি। নাও what are the secretion of the thyroid gland? T3, T4 and calcitonin. Calcitonin also secreted from the thyroid gland. And parathyroid, parathormone. Right? Bas. কটা বাজলো? অন্য একটা স্টার্ট করি তাহলে। পুরোনোগুলো কটা বেশি থাকতো? কত টাইম আছে? হ্যাঁ, এখনো 15 মিনিট আছে। নাও বল, আগের পড়াগুলো ঠিক করে পড়েছিস? পড়াগুলো করছিস? কী পড়েছিস কালকে? কী পড়েছিস? আপার লিম্ব পড়েছিস? তাহলে আপার লিম্ব থেকে ধরবো কোশ্চেন নাকি? টেম্পোরোম্যান্ডিবুলার জয়েন্ট হয়েছে? টেম্পোরোম্যান্ডিবুলার জয়েন্ট এর আগের ক্লাসে পড়িয়েছি। আমি বলেছিলাম যে ফার্স্ট 15 মিনিটস আই উইল আস্ক ফ্রম প্রিভিয়াস টপিক। এগুলো নিয়ে কোনো লাভ নেই, এসব দেখে কোনো লাভ নেই। ওটা বাড়িতে দেখতে হবে, বাড়িতে অনেক টাইম পাবে এসব দেখা। এখন যেগুলো বলছি না এগুলো শোনো, ওইগুলো আমি এর বাইরে আমি একটা কোশ্চেন করবো না। এগুলো যদি কানে থাকে সব কোশ্চেন আসতে হবে, বই এগুলো পাবি না। পাবি কিন্তু বুঝতে পারবি না কোনটা স্যার বলেছিল। আমি যেটা বারবার জোর দেবো দেখবি না, ওই কোর্সগুলো আমি করবো। pterygoid venous plexus এর আগে দিয়ে পড়েছিলাম। pterygoid venous plexus, where it lies? pterygoid venous plexus, where it lies? Mister, বলো, where it lies? The name itself answers the question. Pterygoid venous plexus. That means it has some connection with pterygoid muscle. It lies within and around pterygoid muscle. If it is within pterygoid muscle, and if pterygoid muscle contracts, then it will squeeze the blood, venous blood, and it will send the blood to the heart. That's why it is called peripheral heart. You have heard the name of peripheral heart in lower limb, and it is in head neck. There is another peripheral heart, which is related to the pterygoid venous plexus. Right? Now, from where these veins are coming? These veins are coming along the accompanying branches of the maxillary artery. एटू लिखते हैं maxillary artery. Maxillary artery कितना ब्रांच है? 15 ब्रांचेस. छोटा आर्टरी लेकिन 15 ब्रांचेस. वो जो 15 ब्रांचेस है, फर्स्ट पार्ट का ब्रांच और लास्ट पार्ट का ब्रांच, they will pass through any of the foramina of our base of the skull. So base of the skull जब पूछा जाएगा each and every foramina, तो आप अगर कोई आर्टरी है उसमें पासिंग, तो आप बोल दीजिए सर इट इज द ब्रांचेस ऑफ द मैक्सिलरी आर्टरी, लग जाएगा. एनी ब्रांच विल कम दैट मच. আর বলতে হবে এমিসারি ভেন. কোনো যদি কিছু না পারিস, ফোরামিনা কি পাস করছে? এমিসারি ভেন. এমিসারি ভেন, হোয়াট ইজ एमिसारी वेन? इंट्राक्रैनियल वेन और एक्स्ट्राक्रैनियल वेन को जो कनेक्शन है, दैट इज कॉल्ड एमिसारी वेन. ये छोटा छोटा जो चीज़ है, ये अगर आपका नहीं है तो किस लिए अंडर में पड़ा है? हाँ, हमें सिर्फ मोबाइल दिख रहा है क्या? তোরা একটা করে কাগজে লিখবি যে আমি কীভাবে পড়ালে তোদের সুবিধা হয়. তোরা সবাই নাম দিবি না, তোদের অভিমত আমি জানতে চাইছি আর কি. আমি বুঝতে পারছি না তোদের কীভাবে পড়াতে হবে, আমি তো সেটাই বুঝতে পারছি না. তোরা লিখে আমাকে জানাবি একটা পেপারে যে স্যার এইরকমভাবে পড়লে আমাদের সুবিধা হয়. বুঝলি? নাম থাকবে না তোদের, আমি শুধু তোদের অভিমত দেখতে যাচ্ছি. হ্যাঁ, একটা কাগজে লিখে আমাকে জমা দিবি. হ্যাঁ, বুঝলি? You should write down the what method I should follow so that you can understand. সরে যাচ্ছে, এই যে গ্যাপ হয়ে যাচ্ছে না, একটা ডিপে চলে যাচ্ছে, একটা সমস্যা থাকছে, সেই জন্য যে গ্যাপ হয়ে যাবে, এখানে খুললে তো ওই নাটটা ইঞ্জুরি হবে না. হ্যাঁ, আর এখানে দেখ একদম ব্রাঞ্চের মধ্যে দিয়ে পাস করছে, এই এই ইনফিও থাইরয়েড আর্টারি ব্রাঞ্চের মধ্যে দিয়েই তো এটা পাস করছে, সুতরাং ওখানে ক্ল্যাম্প হয়ে যাবে. Ligament of Berry, one important ligament of Berry. Sometimes may question, what is that ligament of Berry? Just in introduction I told you, when you are swallowing, the gland moves up and down. Why? Number one, here you see thyroid cartilage. Here lies thyroid cartilage. Here lies cricoid cartilage. Now this pretracheal layer, here lies the thyroid gland, and this part is continuous with the fibrous pericardium. Now this pretracheal layer is attached to the oblique line of the thyroid cartilage. It is attached to the cricoid cartilage. This attachment is known as ligament of Berry. So এটা হচ্ছে হাইওয়েড, এটা হচ্ছে তোর ক্রিকয়েড, এটা থাইরয়েড কার্টিলেজ. So as it is attached to all these ligaments, so when there will be swallowing, these three ligaments will move along with this thyroid also move, right? You should draw this picture. Here this is the investigative cerebral fascia, and here this though it is here, it is attached to the cricoid cartilage. Here it is attached to the cricoid cartilage. Actually, cricoid cartilage lies at the level of which level? At the just below the what is the name of this cartilage? Thyroid. Just below the thyroid cartilage is cricoid cartilage. It lies at the level of the C6, cervical 6 vertebra. So this is called ligament of Berry. Ligament of Berry. বাড়িতে গিয়ে এটা আবার পড়বি, পড়ার পর এবার আমাকে এসে আবার প্রশ্ন করবি, যেখানে বুঝতে পারছি না আমাকে প্রশ্ন করবি, তাহলে এই জিনিসটা ঠিক হবে। আর নাহলে lymphatics, where lymphatics goes from the upper part, there is prelaryngeal lymph node and jugulo-digastric lymph node. Here lies the digastric muscle, and there is internal that is কি বলে ওটাকে, this there are two group of lymph nodes, one jugulo-digastric at the level of the posterior of the digastric, and jugulo-omohyoid at the lower part, where omohyoid is crossing the vein, internal jugular vein. তাহলে internal jugular vein इसलिए jugulo, and at posterior digastric, so jugulo-digastric. So upper part prelaryngeal lymph node and jugulo-digastric lymph node. At the lower part, here actually lies trachea, so pretracheal lymph node and jugulo-omohyoid lymph nodes from the lateral part, right? And sometimes also there is lymph node along the recurrent laryngeal nerve. Recurrent laryngeal nerve, lymph node also go to the lymph node along the recurrent laryngeal nerve. So these are the lymph nodes, lymphatic drainage. So that's all.